Hey guys, do you work in emergency medicine, an absolutely crazy and intense environment where you see things every day that a regular person doesn't see once in their entire life? Do you feel burned out, unappreciated, like there's no one you can talk to about the things you are struggling with? Well, you are not alone. I have a bunch of real professionals with real stories here with me today that can relate to your struggles. I've struggled with burnout, discouragement, and frustration many times and still struggle with it occasionally. My name's Aaron. I've been in emergency medicine for 15 years as an EMT, paramedic, and now emergency medicine PA, and I am the host of the Practical EMS podcast. We've got some new guests with us today and some returning, so we're going to jump right in and do some introductions and talk about some awesome topics today. All right, so we'll go ahead and get started, guys. I like to start the show by having everybody just introduce themselves, how long they've been in emergency medicine. And if you have like a story you want to start with, that's fine. If you don't, that's fine too. We can start over here with Nate if you want to say, kind of just introduce yourself and all that.
So yeah, I'm Nate. I've been here for a while now. I've been EMS for 9 years. Now I'm at the hospital, which is so fucking weird. But if you guys are already on the live stream right now, I'm alive. I didn't end my life, so that's good. I've been in rehab now for about a week and a half, and this is week 2 of being sober. Sucks ass, but I know it's for the better.
After we introduce everybody too, if you want to kind of open up about your struggles and stuff, I think that would be helpful for people to hear too, but we can kind of go around the circle first if you want.
All right, I'm Kate. I've only got about a year under my belt in EMS. I also work in a hospital. Before that, I worked in a pediatric clinic, and that was not my thing at all. So emergency medicine is definitely where I like to be, but I'm still pretty green. So still kind of learning what I like to do.
Nice. Very cool. Everybody knows me. So Alex,
Excuse you.
I'm Alex. Currently a paramedic. Been in EMS now for 8 years. 6 of them has been as a paramedic and 3 of as an EMT. So I enjoy what I do. I love what I do. I don't know if there'll ever be an end to this, really.
Hi, Sarah.
Hi,
Hi.
I'm Sarah. I'm also a paramedic. I've been in EMS for 8 years and I love it. Same.
No, my phone's already.
I don't know that I'll ever stop. Maybe I will, maybe I won't, but I love it. And yeah, I work in a fire department and it's fantastic.
Yeah. So we've got 2 paramedics, 2 EMTs today, and 1 PA. So
You just gotta put that in there, do you?
yeah, no docs, no nurses today, so we can talk some shit about
Too easy.
docs and nurses today, I guess. So the first thing I wanted to talk about with you guys, especially considering that we have more medics and EMTs today than usual, is what makes a great paramedic. And the EMTs can answer that too, because you guys kind of have a different vibe, I think, for it from your various kind of experience levels. But whoever wants to start, what, in your opinion, what makes a great paramedic?
I'm just gonna take this right
I know. I'd much rather hear from the EMTs on what kind of makes a great paramedic, because I think we all think we're great when we're paramedics.
Especially when you're brand new.
Yeah, I mean,
fresh out of school and you're
Yeah.
I don't know what the fuck I'm doing.
The newer you are, the better you think you are.
Exactly.
100%.
No, but like with my experience, I mean, like the biggest thing I've always said is like treating your partner like a partner and not like a stretcher pusher. Because like I know, you got 3 letters or you have your letters on you, but like treating EMTs like trash, that makes or breaks somebody completely. Like that can make or break a shift, that can make or break a career. And then some EMTs will just go straight to med school so they don't feel like shit. They're not going for the right reason. Or, EMTs, you'll be on scene of a call and then they're like, hey, what if this is going on? Shut up, go get the stretcher. And like, that can, to me, that what makes a paramedic a good paramedic is treating your partner like an individual, like a person.
Yeah.
And being there for them whenever they have questions, not being a prick about it, just going like, hey, this happened on this call. What are your thoughts? And then we can talk about it and then they can learn things.
Mm-hmm.
But also being that figure of I need an adult, and you're like, I got you. We're okay. Everything's okay. And then while you're sitting there crying inside.
I think kind of to hop on what he was saying, the best medics I've worked with are the ones that were able to like educate without belittling the ones that like were like, hey, it would really help me if you would be able to learn how to do this. This is the best way I learned how to do it. And then they would teach me how to interpret EKGs, or they would teach me the best meds, or they would walk me through what they were doing as long as they had the time.
Yeah.
So it did like establish a level of, I don't know if equality is the right word there, but like Nate was saying, like a partner on partner versus you're just going to do what I ask you to do, which I think comes with anyone that's got like a certain degree of education. But it definitely, those have been my favorite medics to work with, are the ones that are like, hey, I'm going to teach you along the way and show you how to do this along the way. Was always my favorite people to work with, for sure.
Yeah, like in medicine, like education, like educating those around you that may not have gone to school as long as you is super important, because we're all at different levels and different experience levels. So if like you're not willing to educate those around you and just demand they do exactly what you say, like you're going to run into problems, you know, like even when I put in orders for the nurses and they don't do it without questioning, I prefer that, because if I put in the order wrong and they're not like, this doesn't make sense, but I'm just going to do it anyway, like that could be a huge problem. Like I put in an order for dextrose for a patient that was hyperglycemic. So I ordered sugar for a patient with too much sugar, for those layman's terms. And the nurse pushed it because she didn't question the order. She's like, well, I guess I'll give this. And I'm like, I didn't mean to put in that order. Like, so I prefer people to question me. So then that way mistakes aren't made as often too. So, I mean, that's just a big deal.
I'll be in the corner. I know I'm just a little tech and all. But Aaron, that doesn't make any sense, bro. You have to explain that shit to me.
Which I would prefer for you to question, you know, an order if it doesn't make any sense.
I think for me, going even from teaching like paramedics as of like, you know, students, or even, you know, training new paramedics into a system, one of the big things I always kind of see of what's going to make a good paramedic is the ones that kind of even ask the ones that have been around. You know, if I have an opportunity to sit down with a paramedic that's been doing this for 30, 40 years, I'm going to sit down and I'm going to listen, you know, because I'm going to continue to try and learn. The ones that kind of feel like they've learned everything and like, oh, you know, I don't need to know that. Those are the ones where, you know, I feel like there's just some sort of, you know, in the long run, you're probably not going to be here much longer kind of a thing. Definitely as another paramedic, like that's somebody I don't want to work with. As a paramedic that feels like they've kind of, you know, reached their max in such a short period of time. I mean, when I talk with some of those ones that have been around for so long, you can still see that they're like, I still don't know it all, you know? So keeping humble about what you do, I think is a big thing when it comes to being a paramedic.
Yeah, absolutely.
I agree with all of you.
Good talk.
Thanks. No, I definitely agree. Like, one of the things that makes a paramedic a good paramedic, and even an EMT a good EMT, is to continue learning and to ask questions. I think it's sad that you've had that experience where you've worked with people and they've like belittled you. That's not how you make a good partnership. And so yeah, but I was super lucky as an EMT because all of my partners, and I worked with a lot of different people, because like being an open shift or something, you didn't really know like who you were going to get that day. And so I was able to learn a lot about different styles of medicine, different thought processes. And then that's, you know, taken all of that and put it into my own practice. So I think it's really important to be a good EMT and a good paramedic. And if you have a unit that has those same ideals, then you're going to be really good at your jobs.
Yeah, I had a paramedic partner when I was a newer EMT, and some of his skill set was actually like setting me straight when I would be like way too cavalier about stuff, or like once you've settled in as an EMT and you're like, I got this, and you're like joking around maybe a little bit too much, like you kind of think that you know exactly what you're doing. I'm trying to think of like a specific example of like when he had to set me straight. But one I can think of is like we were dropping off a patient in one of the local ERs and they were super drunk. And I like checked, you know, we always check their blood sugar, right? To make sure this isn't like DKA or hypoglycemia, like all the mimickers of alcohol, right? And I was like, yeah, so I checked the blood sugar. It's normal. So we know they're not hypoglycemic. Ha ha ha. I'm like, you know, trying to get the ER staff to laugh and just like way over the top, like joking around and writing off the patient. And he's like, hey, Aaron, like, I know you're trying to be funny, but sometimes your shit's not really that funny. Like, why don't you just be a little more professional sometimes? But it was like stuff like that too. Like, and he kind of set me straight sometimes. So I also think like being a good paramedic is also like knowing when to kind of correct bad behavior if, you know. So I learned a lot from him. You guys probably know him, Matt. I guess I won't say his last name, but he's not here anymore, but he was awesome. What do you guys think makes a great EMT?
I love the ones that like, for me, it brings me back. I mean, after 8 years of doing this, I know it doesn't seem like a long time, but the ones that I still see that like glitter in their eyes.
Sparkle.
Yes. Just this, like, you're just looking at them and they're like, let's go to the ambulance. And you're like, okay. Like, it kind of brings back my like ideas of like how it was when
I haven't
first
seen that
started.
sparkle in a while.
Bro.
I mean, and that's like in my own side. So it kind of helps me like, man, there's still people that are eager about doing this, you know?
They don't hate their lives yet.
Yeah. But then, you know, because of that eagerness, they end up ask all the questions. And one of the, like, I've had so many partners are like, I'm sorry, I'm probably boring you with all these questions. Ask them. I love them. Because for me, it's like, when I start to answer these, it's bringing all that stuff back up in my brain too. And it keeps it there in that forefront. And that's why, like, I love teaching and teaching people, because it keeps it all fresh. And for me, a good EMT is one that's like, oh man, I messed up. What can I do better? You know, maybe not every call, but, you know, sitting down and being able to ask those questions. And I always tell people, like, I'll talk your ear off if you want me to, but I'm not going to come to you. If you feel like you don't have any questions and you obviously felt like you did great, I'm not going to be like, you know, I don't yell at people either. I'm not a yeller. I dad people. I'm really bad at that. I'm like, okay, now, Nate.
I'm not mad.
I'm
I'm just disappointed.
I want you to sit right there and think about what you did.
I'm sorry, Daddy. I'll go sit in the ambulance.
When you're ready to come discuss this, we'll talk. Okay.
Go in the rig and think about what you did.
No words are going to be up there. I'm gonna, you know, you're gonna feel it.
Yeah, I like having EMT partners that ask a lot of questions too, because I also like to teach people. And same, like, if you're gonna ask me questions, I'm gonna answer them or tell you to look them up, because that's how I learned and it worked. So
give them that long, drawn out question too, to see how interested they still are.
yeah, but I think it's just so important in our job to be somebody that you can ask questions and then be someone who will answer them.
I think that like, as a medic, we, like, something I've kind of seen is like, we have this establishment to try and like bring EMTs deeper into it, right? Like, I want every EMT that I work with to become a paramedic, because it's more knowledge, it's more skill set. It's an entirely different field, just even running a call from like as an EMT to a paramedic. And I feel that if we don't cultivate the EMT to enjoy it as much as we do, and you get that bad partner that's like, go get the stretcher, you're not going to be there for long.
Yeah.
You know, you're going to go somewhere else. You're going to go to a hospital. You're going to go somewhere else. EMS and pre-hospital care is not going to be your thing, because you're just going to think everybody's just, you know, grumpy all the time.
Yeah, I think ongoing education is like so important, because it's motivating when you're at work. If you're like constantly learning and constantly improving, like that actually gives you some purpose and like reason to keep going, you know? Like, if you're not learning, you're just going through the motions, like you're going to be really unsatisfied with your job. Like Nate talks all the time about all the paramedic stuff he's learning, and, you know, cardiology and all the EKG stuff that he's like constantly learning. I think that just keeps you motivated and keeps you good at this job.
I like a kudos when you're like, hey, I think that's what that is. And then your medic or whoever's like, yeah, that's what it is. That just, I'll ride that high all day long. I saw it. I found that stimmy.
I'm smart. SMRT smart.
Well, that's, I mean, for us too, it's like, oh, they kept it in their brain when I taught them, right? Like, the first time that, like, even moving forward, like, my wife's a paramedic, and watching her teach new people the things that like I helped teach her as she was becoming a paramedic, I'm hearing those same things that she's saying to people, and I'm just like, oh my gosh, like,
It's stuck.
It's not only did it stick, but it's also moving forward with other people, you know, and that in and of itself is just like, oh, wait a minute.
That's good. It's awesome probably watching like those generations of medicine go down, because you were taught like, hey, this is the new thing we're going to do, and then you get to teach it to someone else too. And now it's just the only thing we've ever known is like the newest thing within the past 4 years.
Yeah.
which is pretty rad.
Everything you hear today from myself and my guests is opinion only. It does not represent any organizations or companies that any of us are affiliated with. The stories you hear have been modified to protect patient privacy, and any resemblance to real individuals is coincidental only. This is for educational and entertainment purposes only and should not be taken as medical advice nor used to diagnose any medical or health care conditions. I also want to talk about struggles that you guys have had in emergency medicine. And maybe we can use that as the segue for Nate.
I feel attacked on that one.
If you're open to sharing kind of your story, Nate, we've touched on it like a lot, but we've never really gotten that in depth. So I mean, as much as you're comfortable with sharing, I think your story for other people to hear is super helpful because a lot of people are in similar places as you. And so whatever you want to share.
No, yeah, I mean, I don't care. I'm open about this stuff. I mean, as you guys know, I'm an advocate for emotional health. So it was about like 2 weeks ago. I'm trying not to get flagged. Almost unalived myself. I'm trying not to get flagged.
Past tense.
Past tense.
That's right.
And then the reality was my drinking just got worse. Like first it was 5 shooters and it would turn 10. And then eventually my wife and I, we blew up on each other. It was building. And then she gave me an outlet. She was like, me or alcohol, just flat. And I was like, and in my head, I'm like, because I didn't realize it was the cravings. And then, so it was like 5 o'clock in the morning. I'm sitting here perusing like emergency places around here, which I'm not going to because we've all been there before. Mm-hmm. And then I found this place right around the corner. So I was like up for like 10 hours, like talking to people. And like, they literally got me in that day in like 20 minutes. So now I'm doing what's called PHP or partial hospitalization. They wanted me to go in-house. That made me just scared. So I didn't want to do that. So I go to this building from 12 to 5, Monday through Friday. It's pretty intense therapy. And I forgot how shitty the cravings are. Like it'll come in waves. Like I literally had like times that I would make up a plan or an excuse just to get alcohol. Like one day I had like a whole plan out. I was going to empty half of my Mountain Dew, go get shooters, put it in there, lie to my wife. Like I had a whole fucking plan. But then I ended up not, thank God. So the biggest struggle right now is coming to terms that like, yeah, I need help again, and I'm 2 weeks, like I said, like 2 weeks clean now. And like the cravings still suck ass. But the therapist there was actually one therapist. She actually used to be a medic for 13 years. So her and I kind of chit chatted back and forth. And there's an acronym that she said, because we all love acronyms. It's called HALT or HALT. And literally like for substances or even like whenever, like if babies are crying, like a lot of this goes under one of these letters. H is hunger, A is anger. And then anger can be anxiety. It can be like feeling overwhelmed. Like anger in itself is a primary emotion. There's secondary emotions that goes with those. L is loneliness and T is tired. If you really think about it, like if you want a cigarette or you want a drink, you fit one of those. Like, you have a shit call. Fuck, I need to smoke. Or you have a long day. Man, I just need a drink. Like, the more she was talking, she broke it down to a science. And I had respect for that. So whenever the cravings hit, I actually had to sit there and like try to think like, okay, what's wrong? And I'm like, okay, I feel kind of anxious. I think that's what it is. Or I haven't slept in 35 hours. I take a few shooters and I'm out, So thank God I didn't withdraw because I've done that before. But that's pretty much what's going on with my life right now.
Is it stuff related to the job that kind of got you to that point or just life stuff or?
So I think it was the job and life. So we actually, me and this new doctor, we're trying to see if my anxiety is more dopamine or epi-norepi. So we've actually we've decreased my Lexapro dose, the SSRIs, and we have me on atomoxetine for the ADHD, but it's also an SNRI. So we're actually trying to see if we can get rid of the norepi, that reuptake, or if it is serotonin anxiety. So the therapist, one of them specializes actually in military and first responders specifically. She made a graph. It was green, yellow, red. Green is where people are like, life is great, life is dandy, there's no problems in the world, everyone loves each other. Yellow is when you're in a state of awareness all the time. Usually they see that with military and first responders. Like if you go in a house, you're looking around the house all the time. You're looking at, their front yard. Is it clean? You're looking at people's hips. Are there weapons? It's a state of awareness all the time. And the more you do it, your body actually does it naturally to the point that you don't even think about it. So your adrenal glands are now producing epi and norepi 24/7, causing that anxious feeling. So it's not the serotonin anxiety, it's more norepi. So we're seeing if we can fight that to a chemical level. So the atomoxetine has actually kept all that down. My anxiety is like from a 5 to like a 1 now.
Okay.
And like I said, I have respect for these people because they're trying to break it down from chemicals into like a science, and they're to each person's needs, not just, oh, we do this with everybody, so this is what we're going to do with you.
Right.
Because thank God my insurance paid for it. It'd been like $4,000.
Yeah.
But yeah, no, like it was that, and then they wanted to peruse the 911 experience. Like I've never had nightmares, but the only one was that kid in the oven. That's always bugged me.
Mm-hmm.
But I think it was a mixture of that and like not sleeping, the department, just being people's. Obviously, you guys are amazing. But I think it was like that, and then I have an addictive personality. So like with me being on serious mood stabilizers, I'm kind of flatlined. But like if I get a substance, I feel something different.
Mm-hmm.
And then, but that coincides with being that addictive personality trait.
Mm-hmm.
That's kind of what we've came up with in the first week and a half so far.
I think a lot of people can relate, though. I mean, alcohol overuse or abuse, whatever you want to call it, like in our field is super rampant, right?
Oh,
like
yeah.
we all know people that have, killed themselves,
Yeah.
From drinking and stuff like that. So I think it's important to hear your struggle because, you're not alone in that struggle at all. A lot of people are dealing with that. And like alcohol really helps too, right? Like
Yeah.
when you drink, you feel great. And that's the
socially
problem.
acceptable.
Yeah.
Yeah.
Going and drinking after a hard shift
Yeah.
makes you feel better and it helps you decompress. But like
Yeah.
the hours after that, the shitty sleep you get after it, the next day, that's where it takes its toll. The problem is it is really helpful in the acute phase.
I went
but
to my first rehab at 22 years old.
Yeah.
And, so it's been an ongoing battle for me. So I completely understand. And I was like, I don't fully abstain from alcohol. Like if there's like a get together, like a family reunion or something like that, I'll have a sip of a glass of wine. But 90% of the time, no alcohol really ever passes these lips just because I know I can't do it anymore. Because for me, it's one step away from being one of our,
Yeah.
that's that's how close I've been. And I understand that struggle of like, and the hard thing too is it's not just even the crazy, it's everywhere. When I say it's so socially acceptable, you go get a gallon of gas and there's tall boys sitting right on in there.
Fireball shooters.
Yeah, it's not like you could go to the 7-Eleven and buy crack nowadays. Like, you can buy the alcohol and it's everywhere. And then you also get these people that are kind of like, what do you mean you don't drink?
Yeah.
What do you mean you don't drink?
Yeah.
Right. And even as like somebody who like drinks, you're like, well, I didn't even think about it like that. Like this, like, you're how old and you don't drink? And it's like, you should be able to control that. And it's like, sorry. My bad. Like, sorry, I can't control this. Sorry, I didn't grow up learning how to take care of myself appropriately without alcohol because it was quicker to deal with than taking the Adderall or taking this because I couldn't get to sleep for periods of time. So what did I do? A lot of mine came from my military time. And that's when it really hit in for me was my alcoholism. And then getting into this job, I was actually sober at the beginning. And then within the first year, I was back to drinking again. I always made it a point to be sober for work because I never wanted to hurt my patients or hurt myself because I loved it so much. That was like the one thing that brought me joy, that I wouldn't want to be that way. But then other things in my life just went, you just don't even care.
Yeah.
You're just like, okay, I'll figure out a way to have you and the alcohol.
Mm-hmm.
You'll do anything too. And you're just, then you find yourself like, why do I got these shooters stashed in my car? Like, where did these
That's
come?
not a flush.
I know. Like, what is going on here? But it's a good thing. And I'm proud of you, bro, because it's not easy. And I think even some people that don't have that, it's like, why can't you just stop? And it's like, I don't know. Like, I just can't. Like, it's in there. Even when I have hard days, it's like still, and this is the one thing I'm going to pass on to you. It never truly goes away because we've spent so many years as that outlet of alcohol, that even to this day, if I have bad calls or if I have, a bad day, the first thing my brain goes to is go pop a bottle.
Mm-hmm.
Right. And that's just because I have to get back into this. Wait. I know that sounds amazing right now, but look how far we've come.
Mhm.
Look how far it's possible. And I always tell people too, even my patients, like, I'm sitting here today with almost drinking a liter at my worst a day, when I had no job, when I had nothing, and almost at the bottom of the barrel before I found EMS and everything. And just,
Yeah.
now I'm here, and I'm, I would consider myself sober because, like I said, I think the last time I had a drink was, I don't even know. It's been at least a year now.
Good.
So,
Yeah.
but
And like I didn't mean to cut you off.
no, you're fine.
Yeah. And the shittiest part is about all this, it's like this stuff gets looked at, judged in such a weird way. And like it's always bugged me. Even whenever I used to do opiates in high school and like the prostitution and stuff, like it's always bugged the hell out of me. Like this stuff gets looked at. And immediately if you say you're an alcoholic, people sometimes think of you differently.
Mm-hmm.
This stuff should be as normal as going to the doctors and getting a prescription for high blood pressure.
Mm-hmm.
Like seriously, like it's annoying as hell that like emotional, like I call it emotional medicine. I know people call it mental. It's a different word. Like emotional behaviors and like emotional medicine should be treated the same as going to the doc, getting your insulin for your diabetes, or getting lisinopril, blah, blah, blah. But as soon as you sit here and say, you're bipolar, you're depressed, you've attempted to leave, people look at you differently. And I guess the dumbest thing. And then like that has such a humongous stigma behind it.
But I think that's why, though, it's because of that stigma. Everybody kind of looks at it as,
Exactly.
This taboo type of situation, and even bringing out, unaliving or past tensing yourself to somebody. People are like, whoa, slow your roll now. Like, how was your weekend? Like,
Yeah.
I tried to past tense myself.
Yeah.
Whoa, how was your weekend?
Yeah.
Waiting for something else to happen. And
Yeah.
I think some people at the same time just don't even know how to approach it,
Mm-hmm.
in society. And even like in our field, sometimes we just don't even know how to approach somebody else having that mental health kind of issue where, like, how do I approach you? Like, hey bud, are you doing good? Like, yeah, I'm good. The line.
Yeah,
like,
I'm fine.
I'm fine. That's
fine.
everybody's answer, right?
Yeah.
But then how do you, like, you don't want to patient your buddy, make them into this. And then you don't want to, that's the other thing too. Like, you don't want to say those words to get them put away, because then you just feel terrible. Like, I just sent you to a facility that we've sent other people to, and like, you're going to be gone for a week, and we already know like you're struggling on all these other things.
Yeah.
And then, how do you help somebody like that? Really, that's always one of the difficult things, I think, in our field too, is like, how do you help somebody that puts, deals with this on a daily basis, and we know what to say, we know what not to say, we know, all of those sorts of things.
Yeah. I mean, this is like, I don't know if you and I have really chatted about this, but this is actually why I joined medicine, was for this stuff specifically. I can give a damn less about like trauma, blood and guts, pregnancies. I'm good. But like, this is actually why I joined medicine, due to this shit in high school and going through a whole bunch of stuff and being looked at as another patient. Like, oh, this 13-year-old just popped pills and tried to end his life again, And like with those calls, I think those are the most challenging calls. Literally, just like what you were saying, like one sentence can like defer someone from being good with you or we're fighting, It's like, it's literally a word game now. It's body language. You know what I'm saying? And like the hardest part about like that I've noticed with other responders, and I mean, I've had issues with it in the past, is, talk to this person like a person so we don't have to go straight to medications. Because I've seen it more times than I can count with the other people, that someone's crying, bawling their eyes out, and then the medic on the other place would just be like, I'm just going to repair Paradol's ass. Why? He's like, well, literally, like, I don't have time for this. It's not about you right now. This dude just lost his wife, and then like his wife just started a 12 gauge. Like, if you're not crying, you're done. Like, I guess
that's the hard thing too, is like even EMT school and even in paramedic school, they don't offer any type of education
Mhm.
within, psychiatric and behavioral health and things of that nature. There is no like in-depth, like, oh, here's our chapter on psych. And they're like, these are the things you might encounter, blah, 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 blah. And then that's it. There's none of this like appropriate, proper way of like handling it. So for us, it's like, jug them up, get them there. Like, this isn't something we're going to have to deal with. This isn't an emergency issue. Like, it's just this like,
Sorry, since I'm the baby here, that was huge in my education. It was verbal
Good.
de-escalation was, I cannot tell you how strict they were on it. They were like, we're not even going to touch this until the very end. Like, restraints and then medical restraints were maybe like a day, but verbal de-escalation, how many simulations were thrown at me where my only job was to sit and talk with the person. And it has helped a lot, like personally for me.
Absolutely love that.
I love that.
And affect like your attitude towards patients and your coworkers. If your teacher felt like you were being a dick during that simulation, they knocked your grade down. And it was like, okay, so you have to really learn how to be respectful now. And it's helped a lot. Especially with the shift that I work, like if there's like an ETOH patient or a psych patient, like sitting and negotiating. I had one patient that was adamant that we all hated her. She's like, you guys just don't like me. And I was like, I can promise you. And like sat with her. I was like, hey, you got real mad there and you asked us, you're like, I don't care what you guys do. She goes, well, I just say things when I get angry. I was like, me too, and you gotta get on a level.
You match their energy.
And you sit there. I'm like, hey, I get like that too. If I start seeing red, if someone's pissing me off, I'm like, all right, square up with me. And so she and I got on a good level, and that training, that like practice helped me a lot, because otherwise I am not a patient person. So that helped a lot there. But on the flip side now, I cannot drink or go out to bars because I'm at a fight or flight status 24/7 because of all like seeing all the people that come in. I'm like, oh, I don't know how to be around drunk people and not anticipate something getting thrown at me now. I can't. It's like a weird 180 from you guys. It's the last thing I want to be around personally. But yeah, no, they teach you how to do it now.
If you guys got any value out of this today, if it resonated with you, encouraged you, the only thing I ask is you subscribe to the show, give a 5-star rating and review, which will help a ton. I don't make any money on the podcast, and it does cost money to do it. So if you want to support the show, go to practicalems.com, join the email list, and subscribe on any podcast player. You can find the clip stuff on YouTube as well under Practical EMS. And we will see you guys next time.